Good morning, and thank you for joining us again this morning. Teresa is not here for the YouTube session, and I'll now report our daily case counts. We now have a total of 15,084 cases to date. This is an increase of 62 cases from yesterday. Of these new cases, 28 are close contacts of a confirmed case, 10 are community acquired, and 24 are still under investigation. We now have a total of 485 cases that are currently active. Out of these 485, 164 of these are variants of concerns, constituting almost 34% of our active cases that are currently variants of concern. Our region has now seen 609 cases of UK variant and 2 cases of South African variant. Unfortunately, we lost 412 lives as a result of COVID diagnosis. This has not changed from yesterday. In total, we have 21 cases in our hospital system and 12 are in the ICU. There are 11 active outbreaks across Windsor-Essex. 9 of these are workplaces, 1 is a school, and 1 is a long-term care home. In total, we have vaccinated 134,424 Windsor-Essex residents who have received at least 1 dose of the vaccine. I'll now move on to our PowerPoint slides. Okay, so I'll start off with the cases in Windsor-Essex and COVID cases in Windsor-Essex and Ontario. Looking at our epi curve of Ontario, this is what the third wave looks like, which is clearly much higher and bigger than the second wave, which we have seen in December-January timeline. It is almost an increased exponentially where we had a relatively gradual increase of the case. This past week, the 7-day average is starting to level off in the province. Looking at our local cases, what we can see is our cases are increasing as well, and we can see that we were steady, but then we are starting to see an increase in our local cases, which is again anywhere between 60 to 70 cases that we are reporting, which is much higher than what we like to see in our region. Hoping that since we have a stay-at-home order in the last 2 to 3 weeks, so it should start to taper off, but it is still a concern, and we all need to be careful of how we are taking all these public health precautions, either in private gathering or in your home. Obviously no social gatherings are allowed, but even individually or at the workplaces. We have 9 workplaces that are currently in outbreak, so something that we need to be mindful of, that with 33% of our cases that are currently active are variants of concern. Things can change very quickly, and we all need to play our part to ensure that we get ahead of this and take all the precautions as we need. So comparing ourselves with Windsor-Essex with Ontario, and we can see that clearly the provincial increase in cases is significantly high. Our cases are creeping up, which is something that we are concerned. Looking at our week-over-week incidence rate per 100,000 population for week 18, starting all the way from week 18, which was last year in April, and up until the most recent week. The most recent completed week, which end on a Sunday, our weekly case rate was 92.7 cases per 100,000 population. And again, this is increased, as you can see in this graph. Looking at the past 7 days, our case rate is 95.9 cases per 100,000 population. Again, this is also increased from last week. Looking at our wastewater surveillance data, which is the red line, in the past week, our numbers remain unchanged from the week before. If you're looking at this data and superimposing it with our daily cases, it aligns well with our daily cases, so signifying that what we are seeing in the community is also matched by what we are seeing in the wastewater data. But also just to report that this method of analysis is still under development and is being validated through this study that's being ongoing in collaboration with the university lab and municipalities. So this is results from these should be considered preliminary and are subject to change. This figures look at all the tests and unique individuals tested by week in Windsor-Essex, and in total 323,390 tests were completed as of April 17th, and this is a complete week ending on Saturday. For the week ending on April 10th, our percent positivity was 6.6%. This is again has increased from last week, and just last week approximately 5,323 tests were completed. The slide looks at the most recent 7 days worth of results. The most 7 days are preliminary and subject to change. And in the last 7 day, what we are looking at from a percent positivity perspective is Windsor-Essex has the 12th highest percent positivity in Ontario, sitting at 5.8%. This is roughly the same as we had last week. So breaking our percent positivity data by different age group, and as we can see, the highest percent positivity is seen in the younger age group between 0 to 17, and while the rest of the 18 to 64 percent positivity is fairly close, with the lowest percent positivity in the 65 plus age group, thanks to the vaccines that all of these individuals are now have taken. Breaking it down further in terms of 0 to 17 age group and see where these percent positivity increase is happening the most. And if we look carefully, these percent positivity increase is happening between 14 to 17 years of age, specifying the high school age group where we're seeing most of these percent positivity. And then translating it back, all these percent positivity with respect to the school-aged children and the epi curve in that. And as we can see in the last week or so, we're seeing an increase in the cases in the school-aged children. And again, breaking it down further, comparing the overall versus the 7-day average for the school-aged children, the increase in the school-aged children seems high, and predominantly are driven by the older children, 14 to 17, and the primary source of acquisition is through household contact or other close contact. Windsor-Essex has the third highest rate in Ontario, and we are still doing much better than the rest of the province, and many of these cases we have seen up until last year when our case rates were one of the highest in the province. So breaking it down further by each of the municipality, and starting from April to present, the highest case rate that we are seeing is in the city of Windsor, and we are starting to see an increase in the case rates in the town of Lakeshore, followed by Essex and Tecumseh and LaSalle, while the rest of the municipalities are pretty much close to each other. Looking at the distribution of COVID-19 cases by municipality in just in the last 30 days, more than 2/3 or close to 2/3 of cases are coming from the city of Windsor. And again, Lakeshore constituting 9% of these cases, while the rest of the municipalities are pretty much similar. In the last 7 days, similar picture, majority coming from the city of Windsor, and followed by Lakeshore, and then the rest of the municipalities. Breaking all these cases down further by age and sex, similar pattern. What we are seeing is the shift from the older individuals to the younger age group. Between 0 to 29 is the highest increase that we are seeing in the last 2 weeks, and most of these cases are under these age group. The exposure history. This is overall exposure history, as we can see, looking at in our community with a mix of household contact, close contact, as well as community spread, roughly constituting around 30% of our cases in the community coming from the community spread. And just between April to present, much more clarity in terms of the specific contribution of these sources of acquisition. 30% of cases coming from community, and 33% from household, and then 20% from close contacts. Looking at our epi curve for the variants of concerns, so April, the month of April has clearly seen a strong increase in the variants of concern cases. in our region, and it continues to increase as we move further and further in the month of April. Please note that the last few days data may not have been reported to us by yet, and it's subject to change. Looking at the percentages of how much of these cases constitute our daily cases, this is what it looks like. And again, at one point, 85% of our cases were attributed to the variants of concern, but in any given time, on an average, we can say safely anywhere between 50 to 60% of our cases are coming from variants of concern. And again, same caution, the last few days would be incomplete because of the lag in reporting of these variants of concerns, and it is subject to change. As I mentioned, the main variants that we have seen really picked up in the month of April. And so just looking at all these variants of concern, sources of acquisition, just in the month of April and comparing it with the overall variants that we have seen, not a lot of difference in terms of what we are seeing this month versus overall. Looking at our hospitalization data, and as we see that the provincial hospitalization as a result of COVID is increasing and is at all-time high throughout this COVID-19 pandemic, our cases are relatively stable, and as we are receiving some additional cases from outside of this area, taking up some of our hospital capacity, but just the local capacity is relatively stable for our region. Similar picture in the ICU cases. The province is seeing the number of ICU cases surge to a significant level never before seen. And similar picture in Windsor-Essex. We have seen the worst in December-January timeline, and we do have the capacity to accept outside patient from outside of Windsor-Essex, and taking up some of our ICU beds. With respect to the age and sex breakdown of people who died as a result of COVID, the age continues to be the most significant predictor of people dying as a result of COVID. And as we decrease the age, the people dying from that, the number goes down. Comparing our case fatality rate with the province, our case fatality rate comparing to the province is high as an overall rate at 2.7%, where the province is sitting at 1.8%. Comparing ourselves with the Ontario with respect to long-term care home and retirement home, our case rates are lower than the provincial average, and then but it seems like our community case fatality rate is higher than the provincial average. Looking at our case doubling time, our doubling time is still higher than the province and Canada, which is again, the higher the number, the better it is. But we are coming closer to the case doubling time of the province and Canada. The most recent estimated median R0 is 1.01, and this has decreased from last week, and it's pretty much close to 1, you can say. And as we know, when the R0 is equal to 1, that means each existing infection is causing only one new infection. And then if the R0 is less than 1, that means that the cases are on the decline. If R0 is more than 1, that means the cases are on the increase. So in the last few weeks, we have seen some ups and downs, but we are close to the 1.01 at this time. Now switching gear to the COVID-19 vaccine status, and in total we have distributed 134,000 vaccine to our Windsor-Essex residents, and the slide gives us a breakdown of how many of these doses are administered daily. And as we can see from this graph, on an average, we can safely say that there are days when we have exceeded more than 4,000 doses a day, but typically we are anywhere between 2,500 to 3,000 doses a day that we are administering, except for some of these weekends when the vaccination rate is not that high. And again, some of that is subject to the availability of the vaccine, not because of the inability to have these clinics open. Looking at our cumulative doses administered, and as you can see, the curve is getting steeper and steeper. That means more and more vaccines are being administered in a very quick manner in our community. The start was slow, but then it's picking up, and the curve is getting steeper and steeper every day. In terms of the coverage rate by age in Windsor-Essex, we have an overall coverage of almost 30%, with just our 60% coverage is close to 80%. And as we go down further, we can see a gradient effect with the older individuals having a higher coverage rate, mainly because of the vaccines was available to them much earlier than the rest of the age bands. Looking at our coverage in the hotspots areas in Windsor-Essex, so if we are looking at comparing our overall average, which is close to 30%, our hotspot coverage is close to 27%, with the variation of coverage in different hotspot, and some hotspot coverage rates such as the N9Y, which is much higher than the overall coverage rate of our region. And then we have some hotspots such as N9A, B, and C, which has some of the lowest coverage rate in that hotspot. This is a rough description of the coverage by municipality, where at least one of these doses was administered, but please use this slide as a caution, because we don't necessarily capture anyone who's getting vaccinated by municipalities. So there's a crude way to do that by using some of the postal codes. So just want to say that use this slide as a caution. This just gives us a rough estimate of what's happening in each of these municipalities with respect to the coverage. The slides break down where these doses are administered. So we can see more than 30,000 doses were administered through our pharmacy network, similar picture with our mass immunization clinic, and then the hospital-based clinic that has been on operation since the end of December has given the most of the vaccine, almost close to 60,000 through their network. And then the long-term care home, retirement home, public health has administered vaccines right on site, in addition to some of the other locations, as we can see in this graph. So breaking it down by the doses administered by vaccine type to Windsor-Essex residents. So our workhorse continues to be the Pfizer BioNTech vaccine, followed by AstraZeneca and then Moderna. So same number of doses administered daily by vaccine type to Windsor-Essex. This just gives you a breakdown of how each of these vaccines are administered in every day. And again, Pfizer BioNTech continues to be our workhorse vaccine, with majority of these doses are administered every day. So in summary, the case rate in Windsor-Essex was highest for the most completed week, and we are coming close to 95, 96 cases a week per 100,000 population. Our acquisition source continues to be distributed between the close contact and community transmission. Our COVID-19 related hospitalization and ICU admission have increased this week, partly because of the transfer, some of these transfers, but also for some of the local cases as well. Vaccine rollout continues at a steady pace with available vaccine supply, and we are anticipating when more and more vaccine comes in, we will be able to administer these vaccines very quickly. Our overall coverage rate at this time is 29.9%, but every day it increases by at least 2,500 doses, so that just help us with vaccinating more and more people every day. So with respect to the monitoring indicators, our most recent completed weekly case rate is 92.7 cases per 100,000 population, and just in the last 7 days, it has increased again, 95.9 cases per 100,000 population. Our percent positivity is at 6.6% for the full week, and the most recent 7 days is 5.8%. Our effective R0 is 1.01, which is relatively stable. So before I take question, I want to provide an update to the vaccine rollout for our region. Starting today, all pregnant individuals will be eligible to receive a register for vaccination appointment under the highest risk health conditions. Pregnant individuals may choose to receive the vaccine at any time during their pregnancy. However, essential consideration should be made for those in the later stages of their pregnancy. It is recommended that pregnant individuals have discussions with their treating healthcare provider or with a healthcare provider that is familiar with their pregnancy. And those discussions should include a review of the potential risks and benefit of the vaccine, a review of the risk acquiring a COVID-19 infection during pregnancy, a review of the potential risk consequences associated with COVID-19 infection during pregnancy, and an acknowledgement of the limited evidence from clinical trial of COVID-19 vaccine in the pregnant population. The healthcare provider at the vaccine clinic may not be in a position to discuss all of these issues, and that is why it is recommended that pregnant individuals have this conversation and discussion with their treating healthcare provider. Please note, a letter from a healthcare provider is not required for vaccination. The extended dose interval of 16 weeks remains appropriate for this population as per NACI recommendation and as per ministry direction. Also, starting later today, individuals that are working in the childcare setting, which include all the licensed childcare employees and students on the educational placement who interact directly with the children in the licensed childcare centers and in an authorized recreation and skill building programs, licensed home childcare and in-home service providers, employees of a home childcare agency, and a student on an educational placement can get their vaccine by booking and registering themselves online. And our website will be updated to reflect these changes, and individuals can book the appointment later today under these categories. Please note, under all of these categories, the childcare, they must provide a proof of an ID badge because all of these are licensed childcare, that they should have an ID badge in place at the time of their vaccination appointment. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. So you said that the website will be updated today to reflect these changes, so people will be able to pre-register later on today?
And that is correct. Our team is working on updating all these changes to the website, and I hope that we should be able to update and make it available as soon as possible. I don't want to give a timeline at this time, recognizing that there may be some challenges as we continue to update our website, but before the end of the day, it will be up and running.
Okay, and then separately, there is a new long-term care home outbreak. 3 staff members at Extended Care Southwood Lakes with the B117 variant identified there. Can you comment on that? Do you know if any of those individuals were vaccinated, and do you have any concern for residents and staff there?
And again, without getting into the specific details of the case, we do investigate all of these cases and look closely at all these individuals, and the risk is still deemed to be low given the interaction and the type of exposure that happened, but recognizing that the spread can be very quick, so that's why we have declared the outbreak and is managing it as such.
And finally, some of the data you presented today, it seems to be concerning in that they're all numbers that have risen since last week. How are you feeling about where our region is headed right now, and can we manage it? Can we rein it back in?
I think we can, but we need everyone's support. I think what I don't want people to be complacent and think that things are under control. These variants definitely have a potential to turn around and increase at a rapid rate in our region. We know that almost 1/3 of our cases that are currently active are of variants of concern, and it's not the time to let our guards down. And as we have some good news with respect to the vaccine, but we also have some concerning news in the steady increase in the cases. So we'd like to see steadily going down, but that is not the case. So hoping that with at least 2 weeks in since the stay-at-home order came into effect, we should start to see some stabilization or trending down. But I do worry that if people are complacent and if people are not following these precautions, things can get really bad, and none of us want that.
Thank you.
Any questions from AM 800?
Good morning. I'm just wondering, Dr. Ahmed, seeing these numbers today, I know we're just nearing the end of the first week of virtual learning, but is it too soon to start talking about what may happen at the end of next week in terms of if you would be willing to make your own call locally about students returning to the classroom?
Well, if the province have an order to switch to online learning, I cannot reverse that. So we'll have to wait and see what the province come up with their decision, and looking at what the provincial picture looks like. I am not confident that the province will make the call to go back to the classes next week or anytime soon until we get a good handle on these cases. The cases in the province are still on the rise, and some early indication that it's stabilizing, but it's too high. Not only just for our region, it's for the rest of the province.
So are you saying that you're anticipating that students will not be returning to the classroom after the initial first 2 weeks that was announced by the province?
That's what I am anticipating, but again, as I said, I don't have any direct contact. I'm just looking and interpreting the data as it's being presented locally as well as provincially. But again, some of these decisions, if it happens from the province, they'll have to consider everything that's happening inside the province. And because it's a provincial order, it's not even our local concern at this time to make some of these decisions.
You mentioned that obviously you can't reverse a provincial order on the recommendation of virtual learning, but if the province does make a decision to go back to in-person learning, you could make a decision locally to keep students virtual, correct?
That is correct, yes.
Okay, thank you.
Any questions from CTV?
Yes, good morning. Are you concerned with the farmers markets opening soon, and will it be enforced that they sell only essential items?
Great question, and I'm sure that our enforcement team is in contact with our bylaws and the city and everyone who's involved in this setting up this market, and make sure that it is in compliance with everything. We'll have to take all of these factors into consideration. We still have a stay-at-home order. We want to make sure that there are only essential items that are being sold in these markets. So some of those discussions must be happening. I don't want to say what exactly will it look like, but I can assure you that those discussions are happening.
Now, would you be under capacity limits as well? It's outdoors, but how does that work?
I don't know. We'll have to ask our enforcement people to give us a better sense of how that would happen. But I think there are some overall capacity that they'll have to monitor in terms of how many people can be in a defined area just to allow for physical distancing. And even if there is no capacity limit, how do they make sure that the physical distancing is followed? So those are all active conversation, and I'm sure we'll have more details with respect to all of these limitations with these markets.
Okay. And as far as the vaccinations for workplaces, I know that there is vaccination going on at the farms, but are you considering other workplace vaccinations?
We are looking at some of the provincial direction as well as some of the local situation to see if there are any way that we can start and target some of our grocery stores worker. And the logistics and what it takes, we'll have to work on it. But they are in the second group of the priority list from the province, and we are touching on some of the priorities from the first group of secondary priority. And as you know, we know the province and locally, we are opening it up for the pregnant women, and we also added the childcare centers, the licensed childcare centers, and we still have the same supply of vaccine. So we're trying to make sure that we're not ignoring any of these identified priorities and before we move on to the next priorities, but we'll continue to look for creative ways to add more people and more of these priorities in the list to give them the level of protection that they all need.
And just about the pregnant woman, just looking for a little bit more clarification. I know you said, I guess it's more important in the later stages, but if someone's in the early stages of pregnancy, then they should also go and get their vaccine as well?
Yeah, so they can choose to receive the vaccine at any time during the pregnancy, but they need to make sure that they have a good discussion with their treating healthcare provider or with the healthcare provider that is familiar with their pregnancy.
Okay, thank you.
Any questions from CBC?
Yes, good morning. We have a lot of cases involving close contact, younger people, and new variants. I'm wondering if you're hearing anything about what that looks like within families where there may be children and what sort of burden it is for families who are dealing with multiple members infected.
Well, with some of the changes to the case management document and guidance, anyone who is currently symptomatic or identified as a close contact, they need to stay home isolation. So definitely an entire family, if they're sick, it would have a burden on them. And we know that once one individual in the family comes back positive, the rest of the family members are also coming back positive. So it does add additional stress on the family, and that's why it's important that we need early identification of all these cases. Individuals need to be tested, and if possible, even within their home, if they can be isolated from the rest of the family member to prevent anyone else getting infected.
Thank you. And it kind of looks like the vaccination rate for the region is going to go from 30 to 33, a third, either today or this weekend. Is that significant to you? Are we halfway to herd immunity?
Well, we are getting there. I think and again, as I said, because we don't have enough data to say what the herd immunity threshold would look like, I would personally like to see at least 70% of our community vaccinated to feel much more confident in that way. But as we are inching closer and closer, we are seeing some impact in the community with possibly a reduction in the transmission. But again, with the variants, it can change very quickly. So we're happy that we are getting, we continue to vaccinate people, we continue to receive vaccine in the region, but until we get to at least 60-70% of the coverage rate, I'll continue to push for more and more people getting vaccinated.
Thank you.
Any questions from Blackburn?
No, thanks. I'll ask and answer. Thank you.
Okay. Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Yes, Dr. Ahmed, the province has just sent a release that Dr. Williams has said Ontario is now confirming its first case of rare AstraZeneca-linked blood clotting. So I'm just wondering what message you have for people in this region. I know I've seen a lot on social media since the age group was opened up for people to receive the Oxford AstraZeneca. So I guess what's your message to people in this region in terms of vaccine safety and continuing to get the AstraZeneca vaccine?
Yeah, no, I am not aware of that. So we'll have to go and see what the release specifically talks about. But all these vaccines, the safety and effectiveness are monitored at all time. Any data that we find from these vaccine-related events are reported locally as well as provincially and then federally. And if there are any specific concerns identified, those concerns are relayed back to the community with specific details of what we know and what we don't know. The risk for these clots or these rare event is still very low compared to some of the other risks that people can contract. So even for someone who is contracted COVID, the risk of blood clot is much higher than what it is with the AstraZeneca by many times. And for us, even for some of the other medications that people take, smoking, the birth control pills, they can also lead to these blood clots in these type of situation. So overall, from a risk perspective, yes, there is a rare possibility that it could result in that, but the majority of the vaccines that are given out, it's all a function of risk and benefit. With high transmission, with all of that variants that are currently in play, the ongoing risk benefit suggests that people should get the first vaccine that's available to them. We know for a fact that even including in England, where or UK, where they're using AstraZeneca as their main vaccine, their case rates have gone down significantly. So it's much more important to get the vaccine, and most of these events are rare, and it's unfortunate. But generally speaking, all of these vaccines are very effective in preventing severe disease and severe hospitalization. Your risk of developing these severe consequences is higher if you contract COVID versus receiving the vaccine.
Okay, thank you.
Any additional questions from CTV?
Yes, just one more. Provincial health officials are investigating a new trend of people with COVID who are deteriorating or dying at home before seeking medical care. Do we have any evidence of that happening in this region?
Not to my attention, and I think it really depends on some of the, where these cases are coming from, and if there was any barrier for them to access healthcare, or if they are one of those community where people don't go to the healthcare provider until they're really, really sick. So it's unfortunate to hear all of that, but I don't have any evidence locally that this is a concern here at this time.
Okay, thank you.
Any additional questions from CBC?
Yes, one more. Some people tend to feel sick the day after they get their vaccine. And as we get to younger people in the vaccine eligibility, would you advise parents to make appointments on different days so that they're both not affected at the same time?
So can you repeat your question again? Are you saying that anyone who's getting the vaccine, they're taking a day off?
No, I'm asking whether you advise parents to get their vaccines on different days so they don't, they're both not experiencing, any side effects at the same time.
Well, I think I don't want to set up any kind of trend or a messaging in that regard. I think every family situation could be different, and with respect to these side effects such as pain or any kind of febrile reaction to the vaccine, it's still, the number is pretty low, and it's not necessarily a concern that would prompt me to say that only one parent should get a vaccine at one time. It can be possible. Majority of these people do not experience any of these side effects. So I don't want to set up any trend to say that one should do one or the other. People can look into their situation, and if they're concerned about any potential issues, then they can do that. Otherwise, they're I don't have any specific recommendation on that.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone. Have a great weekend.
Thank you.